am Dr. P.V. Bandari. I will be talking for the fourth time in this Mind Your Mind series, which is a joint project of A.V. Baliga Memorial Hospital and One Good Step. Today I will be talking about what is called as talk therapy. I am sure you have heard of this talk therapy for depression. So what is this talk therapy? Talk therapy is something which we psychiatrists in our words call this as counseling or psychotherapy. So basically there are different types of psychotherapies. In this the most important things are when you have some adjustment issues, we impart what is called as counseling. Then there is what is called as cognitive behavior therapy. Then there is what is called as rational emotive behavior therapy. Then interpersonal psychotherapy. And sometimes your therapy should involve your family members. This is what is called as family therapy. And then we also involve sometimes groups of people who have similar problems. This is called as group therapy. So these are therapies which have been empirically tested. They have been tested even with the drug against the drug therapy and in mild to moderate depression, and especially depression involving some adjustment issues. These sort of therapies are found to be very effective. So I thought we should have a separate video on this. So let me start with what is called as the cognitive behavior therapy. Cognitive behavior therapy, the proponent of this particular therapy is Aaron Beck. He talks of this depression is as a result of negative view of self, negative view of past, negative view of future. So he talks of thinking errors which we make. He calls them as cognitive distortions. He also says a person with depression gets repeated negative thoughts. So in fact, the therapist here tries to identify these cognitive distortions. He tries to identify the thinking errors and he helps the client to bring about changes in these thinking errors. In fact, this therapy is actually time-bound therapy. The therapist will be able to tell you how many sessions he would be taking, and it is a result-oriented therapy where probably something between 12 to 24 sessions your therapist will be able to guide you to face your depression. Then there is another therapy called as rational emotive behavior therapy. In fact, this is a therapy which is very close to my heart. The proponent of this therapy is Albert Ellis. He talks about the thinking errors. Again, he talks about what is called as the masturbatory thinking or shoulding. Like he says, many of us make thinking errors like I must achieve this, I should do this. These sort of saying I must do it, I should do it. These are the things which can lead to depression. So he talks about identifying these things. He basically feels, he talks about what is called as the ABCDE concept. So the A is the activating event which leads us to feel depressed. So A is the activating event. Say a friend talked to me badly. So this is the activating event. Then I start having some belief B. The belief is maybe I am not okay. Maybe my friend does not like me. Maybe I have insulted him. So these are the beliefs I start thinking. In fact, I don't clarify with my friend. So then the consequence would be I start feeling sad. I start feeling that my life has become a waste because my best friend is not talking to me. So this is the consequence. So because of this consequence, because of this belief, there is what is called as the consequence C. So the consequence would be I feel sad, I feel hopeless, I feel worthless. So he talks of this ABC. A is the activating event, B is the belief, C is the consequence. Now, he very clearly says that we can never change the antecedent event or the activating event. The friend talking bad about me. It has already occurred. Now what we can change is our belief. So how to change this belief? Albert Ellis talks about what is called as the disputing. We need to dispute that probably the friend was in a bad mood or probably the friend was misinformed. So basically this sort of disputing, this is what your therapist will teach you so that you form what is called as E, effective new way of thinking. So basically Albert Ellis says we try to make lot of thinking errors, and because of these thinking errors we start feeling depressed. So basically we need to dispute these thinking errors and develop effective new ways of thinking. So this is what is called as ABCDE. So he also talks about how a person should have unconditional self-acceptance. Whatever is happening around the world, whatever others may tell about you, even you might have done some mistakes, but still you should always have unconditional self-acceptance. Despite the mistakes, you are you. You should have a feeling that okay, that mistake is over. You should not keep on thinking about that mistake. You should understand that despite the mistake, you are a human being. You have every right to lead a good life. So he also talks about unconditional others acceptance. He talks about how many times we expect others should be like this, others should be like that. We should understand that others have their rights to have their thoughts, others have their right to have their belief. We should always accept it. We should not expect that they should think like us. So he talks about accepting others as they are. Then there is what is called as unconditional life acceptance. He talks about how life will go on. Whatever we think of life, whatever has to happen in life will happen. Whatever has to happen, we'll have to face it. So we have to accept life unconditionally. So Albert Ellis therapy, rational emotive behavior therapy, is one of the most popular therapies in US. In fact, very few people are trained in this in India. This is a therapy which can impart a lot of changes in a person who has depression. Then there is what is called as interpersonal psychotherapy. See, many times what happens is we give a lot of importance to others' behaviors. We start making responses secondary to others' behaviors. So this interpersonal psychotherapy teaches you how to change your behaviors, how to interact with others, how to improve your interpersonal communication, how to react to what others say. So this is another effective form of psychotherapy. See, basically every psychotherapy has its own different ideals around which it works. So in fact there are therapists who are trained in this. In fact, who are the people whom you can contact? What you should understand is, one is psychiatrists who are interested in psychotherapy. There are few psychiatrists who are interested only in imparting psychotherapy. Then there are clinical psychologists. These are people who have a PhD in clinical psychology or MPhil in clinical psychology. Then there are what is called as the psychosocial consultants. These are people who have PhD in psychiatric social work or MPhil in psychiatric social work. So these are the people who can impart these particular types of talk therapy. So please be careful when you select your therapist. Please see that the therapist has experience, and also the therapist has been working at least with a psychiatrist, he is working in a clinical setup. So then you can very confidently talk to them. Now, how many sessions? This depends on different therapies. In fact, as I told you, this REBT, CBT, that is rational emotive behavior therapy, cognitive behavior therapy, interpersonal therapy, all these are all time-bound therapies. Your therapist will decide. Now, what you should understand is, how do these therapies work? Research has very clearly pointed out that just like medications cause certain chemical changes in the brain, these sort of therapies do cause some chemical changes in the brain. Many people, when they are undergoing psychotherapies, they also show a lot of improvement in their neurochemicals. And of course, they learn the new ways of behaving with people, relating to people. So this talk therapy is a very important type of therapy. But what I have seen is the tendency among people when they are diagnosed certain illnesses like depression or even sometimes psychotherapy, schizophrenia, they come and ask for psychotherapy. See, what you should understand is, mild depression, moderate depression, yes, we do recommend psychotherapy, but depression which is severe, depression where a person is suicidal, depression where a person is not able to understand what the therapist says, he has reduced attention concentration, or if the person has no psychological sophistication, then counseling or psychotherapy becomes very difficult. So these are the times where your doctor will prescribe you antidepressants. So please understand that your doctor knows what is better for you. He will definitely decide on what is the type of therapy you require. Of course, you should be informed about these talk therapies. You should know where to approach, whom to approach, and also you should understand that these are all time-bound therapies and it takes time. Then please understand that this video, it is not a substitute for medical consultation. This is just a video which is being done to create awareness on different types of mental illnesses. Please understand, one of the first steps to recover from a mental illness is awareness. The second step is acceptance that you are ill. Third step is analysis. Analysis like what should I do? Should I go to meet a psychiatrist, or should I go to meet a clinical psychologist, or should I meet a psychosocial consultant? This is the analysis you need to make, and also analyze things that are told in therapy. See, therapy, whatever you gain in therapy, this has to be actually transferred to your life in day-to-day situations. So this analysis becomes important. Fourth is action. Living as per the insights you have got in therapy. You get lot of insights when you talk to a therapist. Your therapist will not tell you do this, do that. See, it is not a direction or a directive therapy. It is usually they will tell you what are the pros, what are the cons. You are the person who are going to do it. In fact, there are a lot of components. They will do what is called as activity scheduling. They will also teach you what is called as problem solving techniques. So these sort of techniques you have to use in your day-to-day life. So take action. So basically, I end this video telling you, please never hesitate to take help for mental illnesses. When you have mental illnesses are like physical illnesses. They are due to certain chemical changes in the brain, just like hypertension and diabetes. So whenever you are ill, please take scientific treatment, and please understand that this talk therapy is a very scientific form of treatment. Only thing is, see who delivers it and also follow it properly, and I am sure you will be benefited by this. So this is a joint venture of A.V. Baliga Memorial Hospital, Udupi, and One Good Step, a NGO in Karnataka which is working for improving the health of people. Thank you.